Hey, this is Cindy Ray. This is my presentation on Ebola for microbiology. Now, let's take a look at the Ebola virus disease. The Ebola virus disease, EVD, formerly known as the Ebola hemorrhagic fever, was first discovered in 1976 in what is now known as the Democratic Republic of Congo. It was found in a region near the Ebola River, the geographic area for which it derives its name. Since then, several other viruses bear the Ebola name six that have been identified, four of which have caused disease to appear in humans. The Zaire Ebola virus, the Sudan Ebola virus, the Thai Forest Ebola virus, and the Bundibugyo Ebola virus. The Reston Ebola virus and the Bumbali Ebola virus causes disease in non-human primates and pigs, but have yet to have been identified in a human. While the cause of the disease has not been established, many believe its natural host to be the pteropodid or fruit bats. And how does the Ebola virus spread? This occurs through the handling of tissues, blood, urine, feces, or entrails of the infected animals. Ingestion of infected animals would cause transmission of the virus as well. The evolution of the EVD is believed to be such that its natural host developed the virus and it spread animal to animal, from bat to primate or pig. When it was spread to the primate or pig, the virus developed into the disease. The next in line is a spillover event, in which the virus is transferred animal to human. Once the virus is transferred to humans, human-to-human transmission is now possible. This is accomplished in the same manner, but it is much easier to do so. Body fluids are the method through which the virus travels from person to person. Through respiratory droplets, the sweat transfer to a doorknob, through sexual transmission, or even an unclean toilet where urine is present and a failure to wash one's hands allows the virus a pathway to a healthy person. Individual survivors of the disease face a stigma of the disease in the community in which they are part of. Many also experience mild side effects as well. Side effects such as tiredness and muscle aches. Studies also show that survivors can carry antibodies in their blood for up to 10 years and remain protected from that particular virus. A pregnant woman who survives the Ebola virus poses a risk of transmission to the baby through her breast milk. Because of this, the breast milk should be tested prior to breastfeeding. During the 2014-2016 Ebola virus outbreak, spanning Guinea, Liberia, and Sierra Leone, the worst outbreak on record, the infected numbered at 28,600, and the number of people who succumbed to the disease was 11,325. Less than 2/3 of the infected survive. One thing that was speculated by reporters during this outbreak was the possibility of the virus had become airborne. However, there was no evidence to support that conjecture, and it was disavowed swiftly by the medical community. One of the interesting characteristics of the Ebola virus is the way it invades an organism. Ebola uses glycoproteins as a disguise. The virus's exterior imitates the debris and results from apoptosis, the orderly programmed death of a cell. Normally, when this occurs, healthy nearby cells can detect the remains of their dead neighbors and absorb the wreckage, then carry it away for disposal. Which means when they detect Ebola, they inadvertently welcome it into the interior. EVD presents with pretty common symptoms to start: fever, aches and pains, weakness and fatigue, sore throat, and loss of appetite. Some more intense symptoms include gastrointestinal symptoms, including abdominal pain, diarrhea, and vomiting, and unexplained hemorrhaging, bleeding, or bruising. Symptoms will appear around 8 to 10 days after infection. Other symptoms may include red eyes, skin rash, and hiccups in the late stage. Once EVD is suspected, there are certain protocols that should be met. These include isolation of the patient, notification of public health authorities, and collection of blood samples. The polymerase chain reaction is the most common diagnostic test used. The nucleic acid test is also used, or if NATs aren't available at rapid antigen detection tests should be used. We should also keep in mind that it may take up to 3 days after symptoms present for EVD to be detectable. Until recently, supportive care was the only treatment for EVD. Supportive care such as fluid and electrolytes given intravenously, various blood pressure medicines, anti-nausea and antidiuretics, and treating other infections as they occurred. The most deadly virus in the Zaire EVD, is the Zaire EVD. It has the highest mortality rate ranging from 25% to 90%. This is according to the availability of resources in the area. Unfortunately, most outbreaks occur in the resource-poor areas. The EVD seems to be more fatal to people under the age of 5 and over the age of 40, and females seem to have a better survival rate than the males. In October of 2020, the Food and Drug Administration approved the drug Enmazeb as treated for EVD. And in December 2020, they approved the Ebola as treatment. At any rate, the vaccine Everbo made by Merck received FDA approval on December 19, 2019, and the treatment Ebola made by Ridgeback Biotherapeutics LP received approval a year later. With strides being made, we can hope that this disease will be less fatal in the future. And that's my report. The end.